Hello. Hi. Shout to everyone listening today, especially those from the Empower New Nurses group. I'm happy you are on. I'm Dr. Miriam Smith. I'm the host for the Empower New Nurses show. And today, I'm excited again that you're here because we have different things to discuss. We have different things to talk about and to learn from and to share. And so today, our emphasis will be on emotional intelligence. And someone might ask, what is that? And how applicable is that to this program? Well, emotional intelligence has to do with, it's a concept that has made popular demand, and will say be spoken about so often these days. And the person who we attribute a lot of this information to is an American psychologist, Daniel Goleman. And these are very, very important components of, of emotional intelligence, or EI, in that as leaders, young nurses, sometimes not with a lot of experience as yet, you're thrown into some positions of leadership. So therefore, it's important for you to be aware of this. So right now we're talking like there are five, and I'm going to just say them right now, but my focus will be on empathy. So emotional intelligence consists of 5 elements. 1, that self-awareness. 2, self-regulation. 3, motivation. 4, empathy. And last but not least, social skills. So today I'll talk a little on empathy. And why is this so important to our nurses? Why is this so important as a leader? Why is it so important? It's important because we are thrown sometimes, our young nurses are thrown sometimes into administrative positions. Although the bachelor's and the master's degree trained you, or train our nurses typically to manage and to lead, sometimes our nurses are thrown in administrative positions for whatever reason. So it's very important as healthcare leaders, as healthcare, that this is so important that we're able to guide our patients' outcome. Now, as you know, they have different nurses, the clinical nurse, higher terminal degree, like the DNP, of course, they're trained to be notable leaders, possessing the ability to guide patient outcome. Of course, we'll get the information, the research information from the PhDs or those who do that research, and then we'll take those information, those proven information, into the clinical setting and work on that, or implement that, so that the patient will receive the best care, have the best outcome. So that's very important. So my young nurses, sometimes, as I said, you didn't plan for this, but you have to be open. And one of the elements or the components of the EI, which is emotional intelligence, is the empathy. And empathy, what empathy really does is understanding other people, other individuals. This is the ability to connect and feel what they are feeling, throw yourself into their position and in their place and their person's situation. And as leaders, you should not only identify with others, but you can use that opportunity to develop and to help and mold other individuals along the way. So it's very, very important as you work to bring empathy into your workplace, into your situation, into caring for others, remembering that each person is special. Each person has a right and demerit. And you should bring, and each person bring their uniqueness to a situation or to every situation. We need each other to lean on, to share, because no one person knows everything. So as a young nurse, just remember that it's very important to be empathetic, not just to the patient, but to your other colleagues. Those are my words of recommendation, words of encouragement, words that should words that should be implemented, put into practice as you grow in your nursing career. Very, very important to be empathetic. Throw yourself in the other person's feeling and value and respect others. Be ethical, be supportive all the time, because that's very, very, and that important, that it will take you a long way. You have to be self-aware of what's happening around you, of those with whom you interact, and build relationship. Being empathetic really shows that you have other interests, the interests of others at heart. And each person needs someone else. No one is an island. No man is an island. They are not stand alone. We need others. And we are social beings. So relationships are critical, building good relationship. And that definitely will impact the type of care that we render to our patients. And remember, every time, all patients deserve the best care. All patients deserve high quality care. Do that. You will be satisfied and the patient will be satisfied. You will have inner satisfaction and the patient will have patient experience that will definitely impact their coming back or recommending the hospital and of course your care. You will stand out in those patients' mind, and they would definitely speak highly of you and look forward to seeing you again in the event they get sick. So today, those are my words of encouragement. Just remember to be empathetic as you care for others and as you interact with your colleagues and others. Have a blessed day. All right. You can contact me on YouTube at Miriam Amanda Smith. Also, Spotify, podcast, Mir, and Instagram, TikTok. Now, the book, The Guide to Empowering New Nurses, will be out very soon. I intended for it to be for the first quarter, but it might be for the second quarter. Things are being in place, and the report is that it will be definitely the second quarter of 2023. Thanks for listening. I would like you to just subscribe when you go on the YouTube. Tell your friends about it. Many nurses have been impacted by the information being disseminated here. So make sure you do your part, and I appreciate you. I'm Dr. Miriam Smith, the host for Empowering New Nurses. Yes, show.